Welcome! So, sometimes people may find it really uncomfortable, embarrassing, or otherwise distressing when they're in some type of social situation. Some examples may include meeting new and unfamiliar people, expecting to have a conversation with someone, being observed by others, or having to perform in public. It's possible these individuals may be experiencing symptoms associated with social anxiety disorder, or what's also known as social phobia, which is significant fear or anxiety in one or more social situations. When someone is socially anxious, they might fear that people will be able to recognize their symptoms of anxiety and then negatively evaluate them because of it. They may feel the spotlight is focused directly on them, potentially leading that person to then avoid such situations. However, under the guidance of a therapist, treatment can greatly increase the level of comfort and confidence in social settings, so they no longer have to suffer. One method that has repeatedly been shown to be very effective in reducing social anxiety is exposure therapy. This involves the anxious individual being gradually exposed to the feared situation in order to prevent avoidance while increasing their level of comfort over time. But how can someone's comfort level increase when that situation causes them anxiety? The purpose of exposure therapy is to provide the anxious individual opportunities to face that feared situation, rather than have the anticipation and subsequent avoidance maintain that anxiety. In doing so, they have more chances to see that the outcome can actually turn out better than their anxiety would have initially led them to believe. It is easy for our minds to prepare for the worst, although the reality of the situation might actually turn out much better than anticipated. Consider someone who's starting their first day at a new school and does not know anyone there. They may feel they'll do something embarrassing, or others will judge them. The first step in this type of treatment can involve the individual creating a hierarchy, which ranks each of their fears for that particular situation from least feared to most feared. Then that person can begin by confronting the least feared aspect of that situation, as their anxiety level should be pretty low or even absent at that time. Once they feel comfortable enough and adapt, then they can gradually move on to the next part of the hierarchy, using coping skills along the way to feel more calm and relaxed. If it's too difficult to put themselves in even the least feared situation, then they can vividly imagine what it would be like to be in that setting, while physically being in the place they feel the most safe and comfortable. So, although it may sound counterproductive, actually being in the feared social situation helps to significantly reduce feelings of social anxiety. Oftentimes, it's the anticipation of that feared situation that leads someone to feel more anxious. As mentioned, treatment should be done under the guidance of a therapist, as they can assist the individual to develop a proper hierarchy of the feared situation, come up with a specific plan of action for their current circumstances, and teach effective coping skills to use while in that anxious situation, all while providing support with any challenges that may come up along the way. That's all for now. If you would like to help others learn how to decrease their social anxiety, then please press the like button. Thanks for watching, and see you next time.